Def- Definition: eating disorders are a serious mental health condition. They involve serious problems about how you think about food and eating behavior. You can eat much less or much more than you need. Eating disorders are medical conditions. They are not defective. They affect the body ability to obtain report nutrition. This can lead to health problems like canal disease or even the where they are treated that can help.
Got 60 seconds? Take a mental health minute to learn about eating disorders. Eating disorders are serious and sometimes even fatal illnesses. Eating disorders affect all types of people. People with eating disorders may appear healthy even when they are very ill. The most common eating disorders are anorexia nervosa, bulimia nervosa, and binge eating. People with anorexia see themselves as overweight even when they are dangerously underweight. People with bulimia have recurring frequent episodes of eating unusually large amounts of food. They follow these episodes with unhealthy behaviors to compensate for the overeating. People with binge eating disorders feel a lack of control over eating large amounts of food, but don't purge, fast, or overexercise. As a result, they often are overweight or obese. The earlier treatment is started, the more effective it can be. Talk to a professional healthcare provider. Treatment is individualized, and a person may need more than one type of treatment. Learn more about eating disorders through the NIMH website and spread the word to help someone else.
Pros and cons. Reduction in body density, osteoporosis results in weight and breather bonus. Loss of muscle and muscle weakness. Several syndromes that can result in kidney failure. Failing of fighting, and general weakness. Dry hair and hair are lost in common.
One of the reasons why I was reluctant to seek help was because I thought I'd be judged. I guess society had made it a feminine illness.
I think what GPs need to know or understand is it's not gender specific.
And it is not about control. That's my own personal perception. It's about security. Your eating disorder is body armor.
Well, if you know somebody's doing a lot of exercise, maybe that's consider it could be an eating disorder.
Yeah.
But it might not just be, oh my God, it's amazing you're doing loads of exercise, you're so healthy.
Often, what I've wanted in the early stages of seeking help is for it to be accepted, to be known about, for it to be in the room. I want first and foremost to be listened to, somebody to just hold the space, be empathetic, and for it not to feel like I'm being judged.
From my experience, it can be very frightening to expose the thing that you might be very ashamed of. If someone's going to suddenly snatch it off you or try to remove that way of coping, that can be very threatening.
For that GP, it's 10 minutes of the day, but for that patient, that's weeks, months, potentially even years of thinking about this.
Depression's what I went in for, so it was the crisis point of the depression that got me to go.
My eating was a total mess. I was beginning to have severe gastrointestinal problems. I was having heart palpitations, but I looked bloody fabulous. So my GP was like, oh, you'll be fine.
You already feel terrible about it, but one of the things that was really helpful was when my GP just said, I'm worried about you. She would ask how I felt about this procedure or that treatment. That sent a really powerful, empowering message to me. You're part of the decision making here. I'm not going to force you to do anything.
What was difficult for my GP to understand was the eating disorder was fulfilling a function. So to then suddenly have to deal with it was terrifying.
Somehow you think that if you ask for help, that proves you're a failure.
My GP was great. She really knew the local charities and was like, in the meantime, whilst you're waiting on a referral, here's some groups that can help you. And she was really empathetic. She would always make sure I knew when she was working and so that I could book appointments with her as opposed to having to repeat it to someone new every time.
The GP once said to me, I'm not exactly sure who I should be referring you to. I'm going to have to ask one of my colleagues and I can get back to you. And that honesty was great.
It's a complicated process. There's no easy fix and no two people are the same. I think that's important. We don't all fit into one box.
My GP knew that it was nothing to do with food, but me as a person.
I think giving hope helps. Instead of saying you're going to take the eating disorder away, saying we can give you your attention span back, your love of life back, intellect back, fun back, your personality, your relationship with yourself, with others. All of these positive things rather than taking away stuff.
Nutrition. Without proper nutrition, the gums and other soft tissue inside the mouth can break easier. The grass time production saliva can become inflammatory, and individuals can experience chronic thick mouth, frequent vomiting can ever do their hair. That is due to strong stomachaire acid province over the tongue and removing the enamel from the tongue to the point on the tongue, changing color, shape, and length. The air of the become thin and gray and easily. Eating hard or cold food or drink can be cause infertile. In Ecuador, there are no examples featured on desert disorder. However, the result indicates that in Cuenca there are 15% of women who suffer from desert nutrition problems. And estimates are 3 out of 5 people suffer from bulimia and anorexia. Unfortunately, in Ecuador, there are no general figuration days regular, since they are not considered public health problems.
For a long time, food was all I could think of. It took over my life. I was convinced I was fat, even though my family kept telling me I wasn't. I was hospitalized after I broke my leg. At that point, my anorexia was pretty severe, and I was in trouble. I entered a treatment program, and finally, I'm starting to get better.
I felt empty and worthless. I ate all the junk food I could, and then I felt disgusting, so I made myself vomit. This went on for years. With the help of my parents, I was finally truthful to my doctor. I started CBTE. It was hard work, but I have my life back.
These are the voices of people who got treatment and found relief from the intense and distressing symptoms of their feeding and eating disorders. There are effective treatments for the 3 primary feeding and eating disorders, including medication. Binge eating disorder, or BED, is diagnosed when people eat large amounts of food in a short time. People with BED experience guilt about their eating and feel out of control. The most effective and best studied treatments for BED are enhanced cognitive behavioral therapy, or CBTE, and interpersonal therapy, or IPT. Both help people control their binge eating, maintain a healthy body weight, work on relationships, and manage their distress. Medications can also be helpful, especially if used in combination with CBTE or IPT. Vyvanse seems to help people change their behaviors. Because it is a stimulant, it can be addictive and have side effects, so it should be monitored by a physician. Other medications that can help include SSRI antidepressants and the anticonvulsant topiramate, which seems to help with binge eating and the thoughts that accompany it. People with bulimia nervosa binge eat, but they also compensate with purging, like intentional vomiting, using laxatives, or excessive exercise. The best treatment for bulimia is a combination of either CBTE or IPT, plus an SSRI antidepressant. These medications, specifically fluoxetine or Prozac, seem to change chemicals in the part of the brain that affect distorted thoughts seen in bulimia. They help people regain control over their binging and purging behaviors. People with anorexia nervosa restrict the food they eat and are significantly underweight. They often have untrue thoughts about their bodies and weight. If untreated, anorexia can cause serious medical problems and can even lead to death. Treatment for anorexia nervosa usually involves a team approach, including nutritional support and either CBTE or IPT. The team works toward helping people with anorexia gain weight safely while changing their distorted thinking about food and their bodies. Medication is not shown to effectively treat anorexia nervosa. Feeding and eating disorders affect people's relationships, sense of self, and hope for the future. They can cause significant medical problems and even lead to death. But with the proper treatment, including medical and nutritional support, CBTE or IPT, and medication for binge eating disorder and bulimia, they don't have to last forever. People can recover and find hope and health again, just the way they are.
Conclusion. It is important to understand that eating disorders are diseases. It is common and expected that they better does not try to change the situation. It is not a lack of weight, but a symptom of the disease. The family in this case should be in danger of the specialist consultation urgently. Eating disorder can be successful, treated, and a healthy weight can be restored.